Hi guys, I hope you all are doing well. It's been a minute since I have made a video, but I wanted to give you all a couple of updates and some information that I have been researching over the past couple of weeks. As I mentioned before, my second round of chemo has been a doozy. It has still been a doozy, and right now I recently had my MRI scan of my foot to see if the tumor has shrunk. Today I have an appointment to go in and see the surgeon to see if he thinks it's shrunk enough for us to have surgery, which I am pushing for because I do not want to go back to chemo. Although I enjoyed being, with great staff at the hospital, they were nothing but perfection. And although I received the Patient of the Week award, which is something I didn't even know was a thing, I am not looking forward to going back to chemo. This second round has really been more than what I had thought it would be. And I'm ready to move forward, ready to move on. Let's go. Let's get it over with. But before I do all that, I want to share with you some information that I've been researching. Cancer is the number 2 disease that is killing Americans every single day. Number 2. Number 1 is heart disease. Number 2 is cancer. And so for whatever reason, our federal government has not designated funding beyond research to actually help people who are going through cancer, having to experience cancer. There's no funding available specifically for them, for services, support. There's solely just federal funding for research. Whereas with HIV/AIDS, which is under the Ryan White Act, that disease is not even in the top 10. It's not even in the top 10. However, there are billions of dollars that are going towards research, towards supporting folks, towards helping people who are experiencing HIV, and it's not even in the top 20. It's barely in the top 20 of diseases that are killing people every single day. Okay, so this is the data I wanted to share with you. There's a comparison between HIV and cancer. So, as I mentioned, cancer is number 2 in the nation that is killing Americans every day, right? HIV death is around 12,000, whereas cancer deaths is over 600. Over 600,000 per year. For HIV, there's 32,000 diagnoses, whereas with cancer, there's over 1.9 million. You see a problem here? The cost towards providing services to someone who has HIV is $22 billion, whereas the cost for someone who's experiencing cancer is over $200 billion. Then when it comes to federal dollars spent towards that specific disease for HIV and AIDS, it's $30 billion. $30 billion. So you have federal dollars of over $30 billion being spent towards HIV/AIDS. And that includes support, that includes research. Whereas when it comes to cancers, there's $7.2 billion spent from federal dollars that is mainly focused on prevention and research. So as you can see the chart below where it has HIV, AIDS, and cancer, care and treatment is the majority of the funds that's used towards helping HIV patients and research. Whereas with cancer, there is no patient support. None. That's a problem. I think that's a problem. I don't know about everybody else, but to me, that's a problem. There's an issue there. And the reason why I'm bringing up HIV is because as I mentioned before, I am a social worker. And when it comes to federal funding that comes down, there's this thing called RFP, a request for proposals. If you don't know that terminology, a request for proposals comes out each year in a variety pack of ways, allowing nonprofits, organizations, hospitals, an array of people to apply for funding that will allow them to help people that are experiencing HIV. And so when these requests for proposals comes out, there's plenty of organizations who have an opportunity to apply for all this funding to help the patients that are going through this disease, correct? And so, but when it comes to cancer, there are no requests for proposals available for cancer. This is the number 2 killer in our nation, and yet there's no request for proposals for nonprofits to help this population, for anyone to help this population. It's only mainly designed for research. And that doesn't make any sense. Be it that this is the number 2 killer in our nation, there should be a plethora of funding available to help those who are experiencing cancer. And I'm not just talking about, paying their bills. That's one thing. That would be great. But there's also this level of transportation assistance to appointments. Like right now, I'm in between appointments right now. Why? Because I need to go get my heart checked. I need to go do this. I have an appointment tomorrow for another MRI. And then on Wednesday, I got to do something else. So it's like I have all these appointments going on. I'm not working right now because I'm focusing on my health. But at the same time, there are a plethora of people who cannot do the same thing. They don't have the support. They don't have the family members. They don't have the circle of friends who can help them navigate through these things. I've had plenty of people sending food to our house and doing all these wonderful things. And it concerns me that there are people who don't have that. There are single mothers. There are single people that are alone in their homes who don't have children, who don't have a spouse, who are alone, or who don't have a supportive spouse, or who don't have supportive kids. There should be enough funding available for nonprofits, for churches, for an array of organizations to have what they need to help the people who need it the most. If we have that kind of funding for HIV, which we do, and there's way less people dying from HIV in comparison to those who are dying from cancer, which is in the millions, we have a problem. Something needs to balance out. And I remember back in the 80s and 90s, there was this huge, HIV awareness push, which made sense, right? It made sense. But we have a huge gap in services for those who are experiencing cancer. And while we're in the process of making America healthy again, we need to do something about that. We need to shift the funding. We need to shift things around, because research is good. That's great. But the people that are actually going through cancer need more support. And although I have support, I have family and friends, I am worried and concerned about those who do not. Because you have to first make the decision that you're going to actually go down the path that the doctors are telling you. Like they're telling you to go through chemo. They're telling you hey, we need you to go do this exam. Or hey, here's some medication. There's all these things that go into addressing cancer based upon what kind of cancer you have. Like buying wigs. Like I've never worn a wig in my life until now. I've never done wigs. My eyebrows are not there. I've had to paint those on. I've had to get lashes. I've only worn lashes one time at one of my good friends, her wedding in Texas. And it's like all of these things cost money. All of them. And it's like there should be a greater level of support. And the funding is out there. It just needs to shift. Because if cancer is the number 2 killer in our nation, then why in the world are we just focusing on research and not taking care of the people who are experiencing the disease? So I just wanted to share that. I'm going to go over a couple of details in regards to some statistics I did research on, so you all can be aware, so you can share. And I'm hopeful that this will get in front of the right people so something can change. Because at this day and age, millions of people are experiencing cancer. Why in the world isn't there funding available for nonprofits, for churches, for institutions to help them while they're going through? And I'm not just talking about when they're in the hospital. I'm talking about the in-between time. Like there's times where I just sleep because my body is tired. I don't have the energy to go downstairs and cook and do all these things, cook, clean. I don't have to, especially with my foot. I'm not doing that. Nope. And I'm sure there are plenty of others who don't have the capacity or energy to do the same. So why is there not enough support here? Why are we still focusing on research alone and not helping people get the support that they need while they're in this process? So please reshare, hashtag whoever needs to hear this. I'm going to hashtag Make America Healthy Again, and whoever else needs to hear this. But we really need, I don't know what the budget is for this year. I haven't read through the federal budget in regards to what this looks like for America, because maybe something has changed. But according to last year's data, there's a problem. There's a problem, and we need to make some adjustments.